Hello, this is Dr. Richard Shuey from Back to Health Chiropractic here in Sonora, California. And if you like what you see in this upcoming video and you'd like to find out more information, then please come to my website at backtohealthsonora.com. It's my new website that I'm putting up, and it has some great information about back pain, neck pain, headaches, and many of the other ailments that we treat in this office. Enjoy the video. All right, in this video we're going to continue our conversation about how we hurt our backs out of bending down to tie our shoes or picking up a pencil or any other inane little thing that causes your back to go out and you don't understand how that could possibly cause your back pain. In the previous video, what we looked at was this thing called the feed-forward mechanism. And what I had you do was take your hands, put them on the muscles in the back called the multifidus muscles. These are one of the major core muscles that has this response going. And then had you walk, and I had you bend forward and come back to the upright position and raise one arm while you're feeling the muscles in the back of the other arm. And what I wanted you to get out of that was to feel the muscles as they contract just before you moved a limb or bent forward, did anything. See, your brain needs to be able to tell those muscles to contract and stabilize your spine before you do something. Where it goes wrong is people with chronic back pain, there becomes a delay in that, and so what ends up happening is that the arm will raise first, or the body will bend forward, and the brain didn't tell the muscles in the back to contract and stabilize first before they got down there, and that left the joints unprotected and they was strained and hurt. So that's one of the major reasons why we get back pain the way we're discussing here. And so now I want to talk to you about a pretty cool study that I just saw, and it's a 2006 study, so it's a really recent study, but I just saw it the other day. And what they did is they showed how chiropractic care can actually fix the feed-forward mechanism and cause your brain to control the muscles at the right time. So let's take a look at that. Okay, so what we're going to do is we're going to be looking at this particular study right here. This was done in the Journal of Manipulative Physiotherapy in 2006. It was done by a physical therapist, and what they did in their study is they took 90 healthy young males and they put electrodes on them at certain areas in their core muscles. So what they did is they put them in their abdominals, the transverse abdominis, the inferior obliques. These are two muscles that have been studied quite a bit along with the multifidus and are very important in your core, to your core muscles. Then they took other electrodes and they put them on the shoulder as well at the same time. And then they had these patients raise their arm up, and they got the information from the deltoid and from these transverse abdominal muscles and inferior oblique muscles. And then they kind of gathered that information through the electrodes. And what they found was that there were 17 subjects that had a delayed feed-forward activation. So they had this problem that is common in chronic back pain sufferers, that their brain is not having their core muscles contract before they raise or use their limbs. So this is what was going on. Then they asked them to come back 6 months later, and 13 of them came back for the study, and they put the electrodes on and they checked them, and they found that it was very reproducible. What they're finding is that this delayed problem doesn't just go away on its own. It wasn't a fluke that they had it in that first time. And what is important about that is that the delayed FFA, it predicts future back pain in other studies. And then a very cool thing that they did is then they took these patients, while the electrodes were still on them, they had them lay down and they adjusted them. And sometimes they got an audible adjustment out of it, and they adjusted the sacroiliac joint as well, by the way, was what they did. And other times they didn't get an audible. It didn't really matter between the two groups. And then they retested them, and they found on average that they had a 38.4% improvement in their feed-forward activation. So they'd actually changed it. Even though 6 months of time didn't do that, one instant of an adjustment was able to change it by 38.4%. That's pretty cool. Now, we don't know how long that lasts. That's why we need more studies. We want to know how long this lasts. We want to know if it corrects it permanently. Well, I'd also like to know if that person was adjusted 3 or 4 times, would that improve on this feed-forward activation time? I mean, could it cure it and make it go back to a normal setting?
What I do know is this, is that there are many, many studies that show that chiropractic care plus rehabilitative exercise gives you a better result than chiropractic care and rehabilitative exercise alone. So wouldn't it make sense to use chiropractic care to get you first out of pain, because you don't want to do exercise when you're in acute pain, because that creates bad habits and problems for you. So you want to get out of pain first, use chiropractic care to do that, and to reset the feed forward activation problem that goes along with back pain. And then what you want to do after that is you want to do rehabilitative exercise that's going to kind of burn in that control from the brain to those core muscles and get them to work properly and habituate it, make it something that works normally that way. And that can be done by rehabilitative exercise. That will give you a far better results on your back pain and gives you a real chance at avoiding or decreasing the amount of chronic back pain that you suffer. Okay, so next thing we're going to do is we're going to talk about something that goes right hand in hand with what I just talked about, and that's muscle imbalances. We're going to look at what causes these things, what they think is the cause of it, and then we're going to look at the right exercise to change these imbalances and bring more balance back to those muscles. All right, I'll see you in the next video.